The ideal candidate for liposuction has thick skin, moderate to mild fat, and small areas of concern. Someone who's not an ideal candidate for liposuction would have loose skin, lots of fat, large areas of concern. Liposuction is a procedure that is designed to remove fat from selective areas of your body in order to improve the overall shape and contour. When it comes to mommy makeovers, liposuction should be used at your doctor's discretion to enhance the final result. There are many different types of liposuction, such as suction-assisted liposuction, laser liposuction, ultrasound liposuction, and many, many more. But they all have, in essence, the same elements. They have number one, a cannula, which is a long instrument used to remove fat, suction, to withdraw the fat, and tumescent solution, which is a fluid that allows you to do it safely. Liposuction is actually kind of risky. I see patients all the time who have had liposuction and then have problems. Usually there is some kind of contour irregularity. This occurs when the surgeon is too aggressive with removal of fat. At the beginning it looks amazing, and progressively it gets worse over time. At the end of 1 year you'll have loose skin, rippling, and contour deficiencies. My approach is always conservative. In order to avoid rippling and irregularities, you have to know how much to leave and how much to take. Remember, once you take it out, you can never put it back in. Anyone can suck out fat, but liposuction is an art, and it's all about how much you leave behind. The recovery time for liposuction is about 2 to 4 weeks. It usually depends on how much you've had done. After 1 week, you'll go back to your doctor and have your dressings removed. You'll wear a compression garment during your recovery period, and after 1 to 2 weeks, you'll go back to life as you know it. There are several pitfalls to avoid when it comes to liposuction. Number one, don't be fooled by before and after pictures. As a photographer myself, I know these can be made to look amazing with flash photography and Photoshop. The patient may have a thinner silhouette, but in person, they have obvious contour irregularities and rippling. More is absolutely not better. Frequently, what you have is loose skin, and that's what you're unhappy about, which will only get worse with liposuction. It is better to be slightly fuller with skin that is smooth and tight. Number two, be wary of new technology. New doesn't mean better. Just because a new technology is advertised doesn't mean you can now remove more fat. Frequently, these do not solve the problem of loose skin and still make you worse. And finally, three, transfer to the buttock. Fat transfer, be careful, because if you don't have enough fat to transfer, your surgeon will need to be aggressive and remove what little fat you have from areas like your arms and your legs, giving you an okay buttock result at the expense of damaging where they've removed it from. The most important thing to remember with liposuction is it's not a form of weight loss. It should be used when a patient is at her ideal weight and has areas of stubborn fat that she can't get rid of with normal diet and exercise. It's best used to improve the contour and shape and can really put the finishing touches on a beautiful mommy makeover.